Coding Guideline 1C1d2a. This guideline states that septic shock generally refers to a circulatory failure that is associated with severe sepsis, and therefore it represents a type of an acute organ dysfunction. So for cases of septic shock, the code for systemic infection should be sequenced first, followed by code R65.21, severe sepsis with septic shock, or code T81.12, post-procedural septic shock. Any additional codes for other acute organ dysfunctions should also be assigned. As noted in the sequencing instructions in the tabular list, the code for septic shock cannot be assigned as principal diagnosis. So, for example, in this scenario, the patient was admitted with septic shock due to chronic meningococcal severe sepsis. So, per coding guidelines, the documentation of septic shock implies that severe sepsis is present, as it is a form of an acute organ dysfunction. So first we need to assign a code for systemic infection, and then followed by a code R65.21 for severe sepsis with septic shock. So to path it, we would type in sepsis, meningococcal, and it would be chronic. It would take us to code A39.3. Then for septic shock, we can type in shock, sepsis, shock septic due to severe sepsis, R65.21. Severe sepsis with septic shock. Please note that in this scenario, as the coding guidelines stated, the septic shock is not coded as the principal diagnosis because it follows the code for the systemic infection. So code A39.3 is assigned first, followed by code for the septic shock.